Hey there and welcome. If you've recently had a baby, first off, a huge congratulations. Your body has done something absolutely incredible. So now it's time to focus on you and your recovery. Today, we're going to walk through the essentials of postnatal physiotherapy to help you heal, get your strength back, and just feel like yourself again. All right, so here's our game plan. First up, we'll break down what postnatal physiotherapy actually is. Then we'll get into some gentle exercise plans that are safe to start with. After that, we'll cover some super important tips for everyday body care, while you're looking after your little one. And finally, we'll tackle some of those common issues you might be facing and show you how physio can be a total game changer. So let's start right at the beginning. That time right after birth is often called the fourth trimester. And it's this really unique period of healing and adjustment. Your body has gone through some massive changes, and postnatal physiotherapy is all about supporting you through this huge transition. So what it really boils down to is this. The postnatal period is dedicated time for your body to recover. And look, this isn't about bouncing back, right? It's about a gradual, supported return to feeling strong and functional. You've got to think of it as a crucial healing phase that deserves just as much care and attention as the pregnancy itself. A physiotherapist is basically your partner in this whole recovery process. They're not just going to hand you a list of exercises. No, they're there to help you restore your core and pelvic floor strength, treat any of those new aches and pains, and this one's a biggie, they teach you how to move your body safely while you're doing all that baby care. Okay, so what does this actually look like when it comes to exercise? And I really, really want to emphasize the word gentle here. We are not talking about jumping into some crazy workout routine right away. It's all about safe, targeted movements to wake those muscles back up and help you heal. And the best part? It's tailored to you and your delivery. So you can see your starting point is going to be different. After a vaginal delivery, the focus is usually on things like gentle movement, deep breathing, and of course, those all-important pelvic floor exercises. But after a C-section, the first priority is managing pain and doing really gentle movements that won't strain your incision, like breathing from your diaphragm and learning to cough without hurting. And here is a perfect example of what I mean. A simple heel slide like this. When you do it slowly and with control, starts to gently wake up those deep core muscles. It also gets the blood flowing, which is fantastic for healing, all without putting any real stress on your body. See? Super gentle. Now, if you're recovering from a C-section, an exercise like knee rolling is just fantastic. It lets you start moving your pelvis and lower back again ever so gently, which can help with stiffness. But most importantly, it protects your healing incision. It's all about those safe foundational moves. Okay, we've talked about a few starting exercises, but what about the other 23 hours of the day? How you lift, carry, and feed your baby has a massive impact on your recovery. This is all about ergonomics, basically learning how to protect your body from all that new strain. Just look at this. The difference is huge. Bending over from your waist puts all that pressure right on your lower back, which is already pretty vulnerable after pregnancy. The trick is always to get in close. Bend your knees and use your strong leg muscles to do the lifting. Making this a habit will absolutely save your back. Whether you're breastfeeding or bottle feeding, you are going to be doing it a lot. And hunching over like you see on the left, that is a one-way ticket to neck and upper back pain. So remember this key tip. Don't go to the baby, bring the baby up to you. Pile up those pillows, support your arms, and sit back so you can actually relax. And oh man, this is such a common trap. Changing a nappy on a bed or the couch forces you into that strained, hunched over position again and again. But using a proper changing table that's at a comfortable waist height, it keeps your spine nice and straight. Trust me, that makes a world of difference day after day. All right, let's get into our last section, and this one is so important. It is incredibly common to have specific physical issues after giving birth, and I really want you to hear this. You are so not alone in this. The really great news is that physiotherapy has effective targeted solutions to help you heal. Okay, first up, let's talk about perineal pain. After a vaginal birth, this can be one of the biggest challenges right away. It can make just sitting down uncomfortable, but there are some really straightforward things you can do to manage it. So here's a peek into the physio toolkit for this. Simple things like using an ice pack or sitting on a special cushion can provide so much relief. And believe it or not, gentle pelvic floor exercises where you contract and then fully relax can actually help reduce swelling by getting the circulation moving down there. All right, let's talk about the pelvic floor because it goes through a lot. It's so common to experience things like stress incontinence. That little leak when you cough, sneeze, or have a good laugh? Yeah, that's just a sign that the muscles supporting everything need a little help and retraining. So, how do we work on it? Well, Kegels are kind of the starting point, right? But physiotherapy goes way beyond that. They have tools like biofeedback that can literally show you if you're using the right muscles. Sometimes they might even use gentle electrical stimulation to help wake up those muscles. It's all about finding what works and getting a program that's just for you. Whew, we have covered a lot today, from those first gentle exercises to smarter ways to move through your day. Your body has done and is still doing something truly amazing. So as we finish up, I just want to leave you with this question. What is one kind thing you can do for your recovering body today? Maybe it's just taking 5 minutes for some deep breathing, or maybe it's grabbing an extra pillow before you feed the baby. These small, kind acts are really the foundation of your recovery. Take care of yourself.